When the admin team attaches files into the patient's clinical record, there may be times where certain files require the doctor to review. Gentu introduced a new feature where you can now flag attachments with awaiting review. Once files have been uploaded, within the patient's clinical tab, click on the three dots on the right side of the attached file, then select Assign Practitioner. Select the doctor and then click on Save. The admin team does not need to send a task for each attachment that the doctor has been assigned, as the doctors will have access to a Files to Review list. Within Results and Letters, go to the Files to Review tab. If there are multiple doctors at the practice, click to select the practitioner. All files that require action will be found in the new tab. Go through and review the attachments as required. Within the Preview panel, you can also see whether the patient has a future appointment. If the patient doesn't have an appointment and you require the admin team to organize one, simply click on the Add Task button. Once you've reviewed the attachment, click on the Review button to mark as done. Within the Results and Letters, the way you manage your incoming results and correspondence is exactly the same. Click on either the Diagnostic Reports tab or the Incoming Correspondence tab. Most results and letters that are sent electronically into Gentu will automatically be linked to the patient's record if the name, date of birth, and/or Medicare details match. If the patient isn't linked, click on the Search button. You can manually search for the patient or create a new patient from the details provided. Similar to the Files to Review, you can also see whether the patient has a future appointment booked in. If you would like to organize an appointment, you can also send an SMS directly to the patient by clicking on the SMS icon. Alternatively, you can click on the Add Task button in the top right. Once you've reviewed the result or letter, click on the Review button found in the top right to mark as done. Please note, if an admin user is reviewing these letters or results, the Review button is replaced with Finalize. This allows the practice to differentiate between who reviewed the results